Assessment of collateral circulation of the hand using a pulse oximeter. Now the technique I'm describing, I'll refer to it as the pillows technique. So first thing we want to do is we want to place the patient hand in a neutral position with the palm up, as you see in the picture. Now when placing the probe of the pulse oximeter, when we assess the ulnar artery, I want to place it on the thumb. So that's the ulnar artery. And when assessing the radial artery, I want to put the pulse ox probe on the fifth finger. So that's when assessing the radial artery. Now I'm going to just talk about that a little more here. And why do we do that? So I got my probe to assess my radial artery here. And let's just go back. So if I just put the probe on the thumb and I was assessing the radial artery, I would only be checking the blood flow to the thumb itself. And I wouldn't know about my other fingers if I have that collateral circulation. So when I place the probe, when assessing the radial artery, on the fifth finger, I'm not only checking the patency of the radial artery itself, but I'm looking at the flow across the palmar arch. So it includes my thumb, but I also know my palmar arch is well perfused and my other fingers can be perfused. So let's go ahead and just demonstrate. We're going to assess the ulnar artery. So if we're going to do an ABG and using the radial artery, we want to say if we injured the radial artery, we want to make sure the ulnar artery has adequate flow to perfuse the hand. So what I'm going to do is, since we're assessing the ulnar artery, we're going to place the pulse ox probe on the thumb. So that's what we want to do. We want to place the pulse ox probe on the thumb. We want to look at the hemodynamic monitor, or patient monitor, and we want to view the pleth waveform. We want to make sure that waveform is adequate. And then once it's adequate, we have a nice baseline. What we're going to do is we're just going to occlude both the radial and ulnar arteries. So we're just going to occlude. And we're going to occlude until the waveform becomes flat or decreases by 50% in amplitude. So the artery being assessed is released at this time. So we're going to release that. And we want to observe the pleth waveform again. And we should have a reappearing pleth waveform and within 15 seconds or less. And this indicates a positive test. And I'm going to demonstrate that